What are the main effects and/or focus of COVID-19? COVID-19 is caused by a coronavirus called SARS-CoV-2. This is a new form/strain of coronavirus. It is a respiratory illness caused by a virus that can spread from person to person. The symptoms of COVID-19 can range from no symptoms to mild to severe symptoms, and in some cases may even cause death. Groups including older adults and people who have certain underlying medical conditions are at an increased risk of severe illness. On February 11, 2020, the World Health Organization announced an official name for this disease that is causing the 2019 novel coronavirus outbreak. The first case identified was in Wuhan, China in December of 2019. The symptoms of COVID-19 range from fevers to chills, cough, shortness of breath, difficulty of breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Serious effects can range with long-term effects such as difficulty with thinking, concentration, depression, muscle pain, headaches, intermittent fever, fast beating, and heart palpitations. Many organs besides the lungs are affected by COVID-19, starting with cardiovascular and inflammation of heart muscle, respiratory with lung function and abnormalities, renal with acute kidney injuries, dermatologic with rash and hair loss, neurological with smell and taste problems, sleep issues, difficulty with concentration, memory problems, psychiatric with depression, anxiety, changes in mood, and worst case scenario, death. How does COVID-19 affect the economy in the U.S. and around the world? COVID-19 has created a health crisis and an economic crisis not just in the U.S. but around the world. It has disrupted lives, pushed hospitals to full capacity, created a global economic slowdown. This pandemic has created a demand shock, a supply shock, and a financial shock all at the same time. The pandemic caused lockdowns in order to prevent the spreading of COVID-19 and isolate its victims, but that led to a severe economic downturn. The demand shock resulting from quarantine, unemployment, and business closures saw a blow to consumer services. Lockdown measures and social distancing reduced the economy's capacity to produce goods and services. Shown in the top figure on the left-hand side, the GDP recorded its steepest quarterly drop in economic output in record, a decrease of 9.1% in the second quarter of 2020. To put this in contraction into historical context, quarterly GDP had never experienced a drop greater than 3% since it began record-keeping in 1947. The other graph figure below that shows that the percentage of change in employment relative to business cycle peaks COVID-19 related job losses wiped out 113 straight months of job growth, with total non-farm employment falling by 20.5 million jobs in April of 2020. Impact was greater for women, non-white workers, lower wage earners, and those with less education. Some worldwide economic effects range from the baseline of forecast envisions a 5.2 contraction in global GDP in 2020, the deepest global recession in decades. The pandemic has plunged most countries into recession in 2020. Advanced economies are projected to shrink 7%. Every region is subjected to substantial growth downgrades. These downturns are expected to reverse years of progress towards developmental goals and tip tens of millions of people back into extreme poverty. The pandemic has triggered an unprecedented collapse in oil demand and a crash in oil prices. Should COVID-19 outbreaks persist, should restrictions on movement be extended or reintroduced, or should disruptions to economic activity be prolonged, the recession can become deeper. Some bad impacts to the environment and climate due to COVID-19 range from international negotiations becoming delayed, deforestation in the Amazon, weakening of the climate policies, and less money for climate resilience and renewable energies, rollback of important U.S. environmental measures, scientific research becoming disrupted due to lockdowns and travel bans, and COVID-19 has also vastly increased the use of plastic ranging from gloves, masks, plexiglass, dividers, disposable shopping bags, which has also led to an increase in littering. Despite lockdown, more cards are being used in order to minimize contact with others and social distance. Some good impacts on climate and the environment include green recovery in other countries, starting with the European Commission putting forth the world's greenest stimulus plan, a €750 billion economic recovery plan with the goal of the EU to be carbon neutral by 2050. renewable energy extensions, more biking and walking taking place due to lockdowns, less international travel. Transportation is responsible for 23% of global carbon emissions, with an 11% of the sector's greenhouse gas emissions attributable to aviation, and living a more simple life. How does COVID-19 affect us and our health? COVID-19 can affect your nose, throat, lungs, respiratory tract, which can also cause an asthma attack and possibly lead to pneumonia and an acute respiratory disease. It can also cause organ damage such as our heart. Due to imaging tests taken months after recovery from COVID-19, it has shown that lasting damage to the heart muscle, even in people who have experienced only mild COVID-19 symptoms. This may increase the risk of heart failure or other heart complications in the future. Our lungs, which this type of pneumonia often associated with COVID-19 can cause long-standing damage to the tiny air sacs or alveoli in the lungs. The resulting scar tissue can lead to long-term breathing problems. Our brain, even in young people, COVID-19 can cause stroke, seizures, and Guillain-Barré syndrome, a condition that causes temporary paralysis. COVID-19 may also increase the risk of developing Parkinson's disease and Alzheimer's disease. It may also lead to blood clots, blood vessel problems, which can lead to heart attacks, strokes, which can affect the heart, lungs, legs, livers, and kidneys overall.
The effect that COVID-19 can do to your body, mainly your lungs, they become inflamed and it makes it tough to breathe. It can also lead to pneumonia, which is an infection inside your lungs where your blood exchange oxygen and carbon dioxide. United States is the leading country in coronavirus cases with almost 12 million cases. India is a close second with 9 million, but we also have the most money put into research and hopefully finding a vaccination soon. The methods of preventing total contamination that United States have put and other countries is masks are must, quarantine for 2 weeks after leaving or entering a country, and they highly recommend you wash your hands constantly. Methods we can use as individuals to not spread as much is the mask as suggested. You can use hand sanitizers 3 times before you have to wash your hands. And as well, they highly suggest to social distance, which is staying 6 feet apart. The tools we use to test for COVID-19 is called a swab, and basically they insert it into the nasal cavity of the patient for a few seconds. It absorbs the secretion from the surrounding tissue, and we use the swab to look for viruses and genetic material for coronavirus, and we tell you if you're positive or negative.